Hello, everyone. My name is Jennifer Riley. I'm part of the Together Indiana campaign. And today I'm joined by Peter Broad, the Indiana Borough Council President, and Gerald Smith, the Indiana Borough Council Vice President. So thank you both for joining us. And we're going to hear from you today about your thoughts on the Together Indiana campaign and what's been going on since it's been underway since August. So Peter, I'm going to start with you first. Why was it so important for the borough to lead this type of outreach campaign?
Well, the borough council is responsible for the well-being of the borough to some extent. And we're looking around for what we could do that would help keep the community safer. And this was this kind of information campaign was something that we came up with. And after our manager made arrangements with you folks, it's taken off. It's been very good.
Yeah, it's been a real pleasure to help inform residents about what's going on, what they can do to stay safe. So what is it, if you could pick a couple of things that you want residents, businesses, and basically anybody in the community, what do you want them to know about this campaign?
Well, I want them to know that the word together is the core of what the campaign is all about. We're all in this together. Nobody likes having to do these things in order to keep us healthy, but we do know that we all have to do it, and we have to do it for each other. We can't each go off on our own and take care of it. So be conscious of your fellow citizens. Wear your masks whenever it's appropriate. Keep your social distancing. Don't gather in large groups. And help others remember to do that too. Because if one part of the community starts getting sick, then the rest of us are in danger.
That's right. We are truly in this together, right? So
yes.
Peter, how has the community responded to this effort and to the things that we're asking them to do?
Well, it's a little bit hard to judge, but if we look at the response to the online presence, that seems to have been fairly positive. I wouldn't say that all 13,000 residents have signed into it yet, but a representative sample have. If you walk through downtown, you see the posters up in many of the businesses. And I'm seeing more and more people actually being conscious of the need to be a little careful. We're always going to have the rebels too.
Sure. So if somebody is watching this and they want to get more involved, what can they do?
Well, they can go and look at the website, togetherindiana.com. They can go to the borough webpage. They can contact the council anytime. They go to the indianaborough.com. You can have contact information for everybody in the borough. You can come to a council meeting, and if you have something that you think needs to come to our attention, those are all online and they're advertised, and they're all virtual meetings. We do it on Zoom, and the Zoom links are all publicized in advance. So there's lots of ways for people to contact us to help help you.
That's great. Thank you, Peter. Now, Gerald, let's turn to you for a second. So prior to this campaign, the borough began COVID-19 wastewater treatment testing. Why was that so important for the borough to begin testing the wastewater?
Thanks. Well, we had an opportunity, I guess this was back in early spring, to be part of a national project. It was really trying to collect data on COVID-19 prevalence in wastewater. And I know there's other resources out there to hear about the specifics of how that happens, of the RNA sample that they're testing. But we signed on to this because we thought it could really be a helpful resource for our community, and specifically, for our community partners, and kind of a week-to-week response from the pandemic. This has been an incredibly dynamic 7 months for folks who are the decision makers who are thinking about how are we responding, how are we making sure we're being safe, how we're making sure we're having a good balance. So specifically, we wanted to be able to have some added value to like our COVID-19 task force. And in particular, our resident population, we shift significantly. We knew we were going to have some significant shifts in our population, particularly when all of our student residents were returning. And so we were kind of, again, in this unique position to collect some data over time, and ultimately to try to, give warnings for outbreaks, and help us really keep safe. We also, I want to brag a little bit. We have a state-of-the-art wastewater treatment plant. I encourage folks to check it out. It's not something that people think about it a bit, or think about very much, but it's a real opportunity for us to have some added value there. So we're excited about doing it.
Yeah, it's so interesting. Sometimes you don't think about these things, and this is really a way for the borough to get a little bit more information. So you said that you've been testing since the spring. How long do you foresee it lasting, this testing?
It's interesting. So far, when we think about it, the data has been helpful. There has been some correlation to clinical cases, in particular when the data was spiking. Those moves really correlated, in particular with clinical cases. In particular, near the middle of September, we saw significant increases at the plant. The COVID RNA levels and this data was correlated with what was happening in the community. So. I hope we are able to provide this kind of data until we have some sort of resolution around this pandemic. Obviously, the virus is in charge of the timeline. We are signed on for this testing, I think, through the end of the year. It's a partnership with really communities. I think there are 400 sites across the country. It's the sort of thing, as this data set gets bigger, it generally gets better. We've seen the prediction models change a little bit over the last 2 weeks, and to be much more accurate. So it'll be interesting to see how that plays out. Again, we're also in a unique position having a research institution right in town. So I certainly envision longer-term public health partnerships with IUP and being able to use I can't say enough. People don't think about, what happens. Everybody flushes, as it turns out, and there's a unique position to really collect some data, and we have a position to do that. So not sure. We're on through December. I hope that we're able to continue to add this value to our community though, beyond that.
That's great. And you said it can act as an early warning system, right? Is that what we're going to be using the data for moving forward?
So that's sort of the hope. The data is accurate, but not always necessarily precise. Like I said, mid-September, it was a warning. We saw significant increases right when we also saw significant clinical increases in cases, and largely folks attributed that to our returning student population. However, we had been seeing those increases before. Again, our data, it's decreased over the last week. We're here in the near mid-October, and we're also seeing those cases. So I hope we will continue to gain some insights there.
That's great. I mean, it sounds like the council and the borough, we're doing a lot to make sure that people are staying safe and that they have the information that they need to stay safe and make sure the people around them stay safe. Peter, is there anything else you'd like to share with the folks watching this about the campaign or the efforts that the borough and council are doing?
All I can say is we're very thankful for the cooperation we've gotten from the community on this, and we hope that continues to grow. We're not out of the woods. We've had some bad numbers in Indiana, in the county, as well as in the borough. So we really do need to be careful, and we're very grateful at how many people in our community are stepping up and doing that sort of thing, taking the precautions. We hope things get better. None of us likes being where we are, but if we work on it together, we can beat this thing.
Yeah, we can certainly make a difference. And how about you, Gerald? Anything else you'd like to add?
You know, I guess I want to reiterate a little bit what Peter said. You know, again, recording this in mid-October, I continue to really appreciate, again, how much our community has really done a good job of maintaining, work together, this commitment to work together to get through this pandemic, you know, safely. In my, you know, I talk about in my day job, I work in the schools, in the school district, and I can tell you that the social distancing plans and measures are really fully in effect. I know on campus here at IUP, that it is the same. So the social distancing and masking up, folks are working together. And I think we also, you know, in our community, we see support from us in our businesses. We see science, you know, we all want to be safe for everyone's benefit. So I'm really appreciative of our community really stepping together and working together to beat this thing. And I know, I also want to just mention the borough is continuing to think about what does recovery look like. They started thinking about it over the summer. We don't know what that timeline is, but you know, these are ongoing conversations that we're really thinking about. So look for more to come, I believe.
Well, it's nice to know that you all are staying on top of it and making sure that we have all the tools that we need here in Indiana. But so thanks for you both for joining us today. Community members can stay current with the Together Indiana campaign by following us at Together Indiana on Facebook, Twitter, and Instagram, of course. And you can also visit togetherindiana.com and subscribe for weekly updates and communications. And remember, let's all continue to stay safe together. Thank you.
Thank you.